Thank you all for joining us. We really appreciate that. Sorry, unfortunately, it's not in person. We'd like to have it that way, but of course, that's part of the reason we're here today. And I've been asked just to share with you how it's really impacted our organization and where we presently stand. So I'm going to take you back sort of to the very beginning for us. Now, we've had conversations back in February and early March of knowing what was coming, but not knowing exactly how it was going to be impacted. And it really began for us the week of March 9th. That's when we were also celebrating a major milestone, and that was our 40th anniversary celebration. And we had lots of big things planned and lots of celebrations for all of our staff. And in the midst of that, we're also making the planning for what is going to be the future and how we're going to handle COVID-19. It was a very challenging week, to say the least, and back then we weren't even thinking of social distancing or anything like that at that point in time. Our initial conversations were very much on how we will provide patient care, not if we will provide patient care. That was a given. We knew we were going to provide the care. We just had to figure out how we needed and how we were going to be able to do that. And I can tell you our conversations internally all revolved around how we do that. What's it going to take? Initially, the biggest discussion was probably within staffing and volunteers. The volunteer piece first. Volunteer piece, we have an older volunteer base, and we knew we really weren't going to be able to have volunteers operating like they normally have. And luckily, and for good sake for all hospices, CMS waived some of those guidelines early on. So early on, for volunteer purposes, most were not coming in or traveling. They still helped us, as we hear, some different ways. So most of that conversation was on staffing. They were some very, very difficult and challenging conversations on, okay, we said we're going to provide patient care. How do we do it with staff and keep them safe? Our staff is our top priority, and keeping them safe was number one. And I'll tell you, we make a lot of difficult decisions day to day, and nothing comes more challenging than that, knowing you're putting your staff in harm's way. And I'll tell you, our staff have been absolutely amazing in what they've done. So we also had the challenges of what will staffing look like in 2 weeks, 4 weeks, 3 months, a year, in that will a large percentage of our staff be testing positive? Will we not have them available to care for patients and families? How was the school impact? At that time, schools were just saying we're closing down. How are we going to have enough staff that aren't taking care of having daycare issues? So there were some really difficult conversations on that regard. Personal protective equipment was in all those conversations, PPE. Now, I'm a CPA by background. PPE is property, plant, and equipment. Well, it's not anymore. It's all personal protective equipment, as we've all come really used to hearing. The challenge you've heard on TV and news are very, very real. It was challenging for us in some different ways, in that what we use, Medline as our provider of most of our medical supplies. They came out very early and said, if you don't buy this, we're not going to send you any, weren't buying it before, such as isolation gowns. We never buy isolation gowns. Our staff don't need it. We don't have any. Medline says you can't get any. So how do we get the equipment we need for our staff to keep them safe? N95 masks. We had some, not a lot. So we were improvising on day one. We're gathering as much. We had a lot of volunteers help us in making masks. Our Amish volunteers were making our gowns for us, in the quilters in the group were making the gowns in the very beginning. PPE is much better now. We have about a 2-month, maybe a little bit more on some regards, N95s even more, supply of it, but it's still a very big challenge that everybody is still worried about going forward. We also started with our staff working remotely. You've all met our IT department in many cases, them presenting on things they were looking for. Our IT department is absolutely fabulous and found a way to have almost all of our workers working remote in a matter of about a week. So most of our workers are not coming into the office at all. The home hospice staff, they're coming in when they need to pick up something or certain times, but not very often. The regular office staff, most of them aren't coming in at all. We have about 30 people, I'd say, that are regularly in our Lancaster office. and probably 4 to 5 regularly in our York office. And then the inpatient unit was normal, and I'll talk about that in a moment. But everybody working remotely has gone extremely well, and we're very pleased with that regard. We also at that point started our COVID-19 team. And Laura will be talking more about that in a couple minutes and describing that. The reason we did that was to conserve PPE. We wanted to make sure the staff that were coming in contact with COVID positive or presumed positive had the right PPE. It was an all-volunteer group of people taking care of those patients that you hear more about, but we wanted to make sure we had the PPE for them. Once PPE became more abundant and we had the adequate supply, we now have those patients are being cared for by other teams as well. As I said, staff is our top priority. We've tried to do very hard to make sure we keep staff informed on what's going on, shared with them regularly updates, along with we prepared a frequently asked questions page, so we addressed everything that was being brought out and trying to be very transparent. We also initiated a retention pay bonus program, so an extra $2 an hour for 3 months. We're in the middle of that to reward our staff for doing the services that they're doing. I want to mention that we had no turnovers forced by us. We had no layoffs, no furloughs, no positions eliminated whatsoever. We had 2 groups of positions that had jobs that are no longer really applicable, our volunteer coordinators, as well as our liaisons. With not using volunteers in the way we did before, they didn't have their regular jobs to do. And our liaisons who are going into hospitals, physician offices, and other areas are no longer have that to do. That group in many organizations might have furloughed them or terminated that position for a little while, but that was never a consideration for us either. This is an amazing group of people there that we want to be with us when this is all over. So they helped us in positions that volunteers were previously doing, many times out front line now, which they never signed up for that, but they were out helping us in the inpatient unit, helping us going out to places, picking up whatever was needed in a variety of ways. And that was a great group to be so willing to help. But we have not laid off, not terminated any employees. In fact, we have added over 20 additional positions since the year started. We've only had 3 employees that resigned over the first half of this year to take another job. So that turnover percent is very, very good. We did have a few that have retired that weren't planning on retiring quite now or planning on retiring a little later in the year. And who can blame them for moving that retirement up at this point in time? But overall, we're very pleased with where the staffing has gone, and we've been able to use this opportunity to even fill some positions we've had challenges with before. In regards to our inpatient center, a lot of the early conversations revolved around our inpatient center. Again, many of you know that we cannot take COVID positive patients in our inpatient center. We do not have negative pressure rooms, and in some ways that made the conversations a little easier, that we wouldn't be having those patients. But how do we still care for our community in the needs in our center? And the big part was keeping our staff safe again. There was a lot of discussion on visitation and what types of visitation would and should be allowed. Because at that time, hospitals had said no more visitors, nursing homes had said no more visitors. That was never an option for us. And the entire leadership team agreed from day one on the conversation that we have to allow visitors in some capacity. How do you tell a husband of 50 years that you can't be there with your wife on her last days? That's just not right. We have to figure out a way to do that. So we put in some very limitations, 2 visitors at a time. We put in the screening process. We have our staff that I mentioned earlier. We're taking temperatures, and we've been very fortunate with the people accepting that policy and working with us. And I think all the staff appreciate that policy as well. I also want to mention Good Drive, and where we're sitting, many of you know we have the 12-bed inpatient facility sitting back here, vacant, not using them for beds itself right now. We're still licensed, but the initial conversations regarding inpatient center, a lot of those revolved around, are we going to have enough staff to take care of patients? Because in home hospice, if staff are down, we can shift, we can move some visits around, In inpatient unit, you don't have that ability. You're 24/7. So we have to have enough staff. We reached out to staff that have recently retired, that were worked in the inpatient unit, that are now on home hospice, seeing if we could shift some if needed. Now that was never needed, but we were prepared to do so. For the inpatient unit back on Good Drive, we didn't have the ability to find the additional staff that would be to have this fully staffed 24/7. So there's no way we could have that because we didn't have staff that are furloughed in other areas. We had conversations with both Lancaster General and WellSpan, knowing they were looking at some very a real unbelievable crunch in the number of beds they were needing. And some projections shared that they were going to need twice the amount of beds that they had. So if we came to that, we wanted to help them. So we had conversations, and one of the conversations was very interesting. We're going through all the details, and they mentioned about having to, about paying us for this. I was like, well, we're not doing this for reimbursement in any way. This is a matter of, we're doing the right thing for our community. We're not looking to get paid for this. And the person at the end of the call said, you know, I've talked to close to 100 businesses and you're the first one to say that. I was like, that's the right thing to do. We're here to help, and we're going to help them. If they could staff it, that would be great. We'll help in any other way we can. But thank goodness that has never come to that and never needed. And I want to mention financial position a little bit. We're in a much different position than most others in that we're still receiving our reimbursement through insurances like we always have. So we're fortunate compared to so many businesses that lost all income. Our biggest area will be in fundraising. We're estimating about a $1.4 million reduction in our fundraising budget from what we originally budgeted this year. You know how the Labor Day auction is working probably, and we're still going to be doing a lot of things. We recognize it's not going to make the $870,000 that we made last year. So we're working to continue to raise the funds, and you're helping us do that, which we greatly appreciate. I want to mention the CARES Act too. You heard a lot about the CARES Act. We were part of that. We received a distribution from the CARES Act, and the CMS administrator said, and I quote her saying, there are no strings attached to that money that they received. We have 12 pages of terms and regulations that dispute that fact, and all but 2 of those little bullets on there are very clear, I think, and are no problem. Those 2 bullets raise a lot of questions, and we're still waiting on guidance from HHS on what that is. So we're not sure the ultimate impact, but we know it will help us in some way. They say by August 17th, we will have guidance on that. So just to kind of close it up here and where we stand today, I wrote down in my notes, staff equal amazing. They're unbelievable. You know, they truly are the heroes of the world right now, and they're out seeing patients every day, just like they always have been. Our staff that are working from the office that aren't seeing patients are working remotely, and the work is getting done very well. Actually, we're seeing record number of patients again today, and I wanted to share, most hospices throughout the country are experiencing a drop in census. That's not the case for us. I look back on March 1st, we were taking care of 564 hospice and supportive care patients. On July 1st, that was up to 571. So 571 at the beginning of July, and yesterday, that was 641. That's 70 additional patients per day since the month of July began. That's twice the amount of a normal hospice in the country, just in the change. That's another challenge for staff and how we have the staffing to do that, and that's what we're doing. Another reason that they're heroes, and another reason that the community is still turning to us in these times. It's not that they are coming in large COVID-19 patients. The total we've taken care of, I think, was 129 patients that I last see, and only 5 during the last 2 weeks. Our staffing are doing amazing jobs keeping themselves safe. You would expect some high numbers of impact from our staff. We have 9 staff that have tested positive or presumed positive, I think all of which are either back to work right now already, or one might be coming back shortly. And telehealth, we are doing things more from telehealth, but mostly that's our nursing home teams seeing patients that we're unable to see quite as much there. So it gives us, we really haven't substituted telehealth visits from our regular regular visits very much. And we're not making a lot of changes because things are working so well. A lot of organizations are bringing their employees back. the more employees we bring back into the building, the more chance we have to have additional issues between one another and can't social distance. So we're not bringing our staff that are working remotely back right now. We're going to keep doing that. So I'll just say I've been here for 22 years now, and I've never been more proud to work for this organization. It's a great group of people, and you'll hear from a couple of them coming. So I believe we're going to take some questions now, Dee, or is that going to come afterwards?
We are taking questions now, but at this point there are none.
Okay.
So, but please put in your questions for Steve and we'll come back to him. So now we have Laura Carey.
Okay, again, I'm Laura. I'm a home hospice social worker. I'm currently and have been for some years on the Indigo team, which mostly is in senior living facilities, nursing homes. We have a few home patients, but I'm here to talk about my experience on the COVID team, which was for 8 weeks in April and May, as Steve alluded to. So the creation of the COVID team, Steve's already discussed that in terms of trying to conserve the PPE that we had available to us because there was extra things that nobody had. So that was a big concern. And I think also to minimize the exposure of COVID-19 to the wider staff. So there was an email that went out asking for one person from each discipline, RN, LPN, social work chaplain, and hospice aide, to volunteer for the COVID team. And when I first read that email, my first thought was, well, nobody will volunteer for that. Who would do that? Because you have to remember, this was back in the very early days when it was very uncertain, everybody was very fearful. And then kind of immediately, I kind of realized I was the obvious choice. I have been here a long time, so I have some experience under me. I don't have anyone at home, I live alone, and I don't have anyone who depends on me for their care solely, like a disabled family member, an elderly family member. So I think I realized pretty quickly that it should probably be me, because we have a lot of younger social workers with young families, and I didn't want to put them in that position. So we were on call 24/7, 7 days a week. Thankfully, we weren't working 24/7, 7 days a week. But our task was to see all the COVID positive patients and presumed COVID positive patients in our 7-county area, wherever they were, in facilities and homes. Most of our patients were in facilities, nursing homes, or the hospital. There were some that we did have that were at home. And I think it was really important to have the team because everybody was so fearful. And I think there was sort of a sigh of relief when everybody realized they wouldn't have to do it. And also there was a real obligation to our patients and families and our community. I personally know of other hospices that were in nursing homes that by the 1st of April had said, we're not coming, we're gonna make phone calls and check on the patients, but we're not gonna come in your facility. And I regularly got feedback from the nursing home staff at all levels, how appreciative they were that we didn't abandon them, that we were the hospice that was in the trenches with them and supporting our patients. And that for me was probably my proudest moment with this hospice in 20 years, that we stood out and that we didn't see ourselves as an entity that didn't need to be involved and didn't need to be with them and just would make phone calls. So there were challenges on this team. There were lots of gifts, which I really didn't anticipate. Like I said, I was kind of the obvious choice, so I wasn't really anticipating much. Challenges included, for someone like me, learning to use the PPE. It's more complicated than you realize when you haven't been used to it, and especially taking it off safely. Everybody was dealing with the changes of the rules in the nursing homes, in the facilities. It was every day. It was go in this door, go in that door, get your temperature taken, fill out a form. I mean, and it was a constant change. What you had to wear, what level of PPE, and that's still going on actually. And of course, there was the fear. I had it, everybody had it. So that was a challenge. And also I think it was a challenge, although a wonderful opportunity to support the staff that were working 8 hours a day on a COVID unit. They didn't have the choice. They were just told they were working there. So that was a challenge too. As far as gifts, I was really proud of the support we were able to give the staff, both nursing home and hospice staff. I had a lot of questions asked of me in-house, in addition to the nursing home staff. And I feel like we were able to just sit, listen, let them tell their story, and maybe help with some of their fears. Of note is that of the 5 of us on the COVID team, exactly 0 of us got the coronavirus. So we did a pretty good job protecting ourselves, and I think that was reassuring to the other people. The most profound thing to me, I would say, is that we were able to be the link between the patients and their families. During the early days, and even in some situations still now, many situations, the families absolutely could not come and be with their family member, even if they were at very end of life. They were not allowed in at all. And we were the ones that could go in and be with that patient, tell them their family loved them, and I always tried to remember names of their family, hold their hand, sit with them at the bedside, and then report that back to the families. And one thing that was terrific about COVID team is we didn't have a typical caseload. Our highest in a single day was about 8 patients. And right now I have over 30 patients on the Indigo team as a comparison. So we did have more time to spend doing whatever needed to be done with the staff, with the patient, talking to the families. They would get 2 calls a day because 2 of us would visit. And I had more than one family member crying on the phone, thanking us for just being that link and linking them with their family member. We did start using FaceTime. We got the family on the phone so they could say their last goodbyes. And it was very heartbreaking, but it meant a tremendous amount to the families. It truly did. I'll share one story from my experience over the 8 weeks. We were asked to come in on a Sunday afternoon to admit a woman who was COVID positive at one of our nursing homes. And this nursing home had a whole unit full of the COVID positive patients. They also asked if we could look at her husband, who shared a room with her, and see if he would qualify for hospice care. He had had a test, but it had not come back yet. So Minda Bernhardt, LPN on the COVID team, and I went to see this couple. She was clearly near end of life, and her husband shared a room with her. They've never been apart, even though they have 7 children. They've never really been apart, married over 70 years. He was sitting at the bedside, holding her hand, talking to her, stroking her arm, and just grieving. She was clearly dying. She met criteria for hospice. He really wasn't at that time. So we couldn't admit him, but of course we spent time giving support to him. And then I left the room and I was trying to kind of work on the paperwork part of the admission. Minda came out and said to me, I think that this woman needs to hear from her children before she can relax and die. So Minda took the initiative to contact the primary contact person, one daughter, and then subsequently contact every one of the 7 children, put the phone up to the patient's ear, let them say their goodbyes, let them talk to their dad, say what they needed to say to him. And all in all, the 2 of us were in the visit, just the visit, not the documentation part, but just the visit for over 3.5 and maybe 4 hours. And in the course of a normal workday, of course, that would be an impossibility to be able to do that kind of thing. So that was but it was needed. It really was needed because none of those children could come see their parents. So that's what I mean about just the value of being able to just do that and spend the time. So we admitted her that afternoon. She died that evening. And then that was Sunday. And then Tuesday, the facility called us back and said, her husband has a positive COVID test and he's not doing well. Would you come visit him? So back out we went, Menda and I, to see the husband. He was curled up in the fetal position in her bed, not in his bed, but in her bed, and was not talking. He was awake, but he wasn't talking. He wasn't responding. He was dying of a broken heart, I think, more than he was of COVID, but he had both issues going on. And he had not had anything to eat or drink since she died. So we admitted him, and we just sat on his bed with him and talked to him about his wife, his children, his love for his wife, and how we knew that he wanted to be with her, and gave him our blessing on that. And he died early the next morning. And while that's a really sad story, it's also a really sweet story of a long love, and that we were able to be a part of that experience for them and help them maybe have more peace and also bring their family into it, even though they could not participate. So I think I've already said this, but I'll kind of wrap it up and say that being part of the COVID team allowed me to just go back to the roots of why I became a social worker in the first place, to give emotional support, to have compassion, show compassion, to be able to spend time with people and the time that they needed for whatever their situation. Just to be able to sit on the bed and hold the hand of someone who nobody wants to touch and nobody wants to be around because they're afraid. And I don't mean by that the nursing home wasn't doing their job, they were, but of course they were busy with other patients. And just to be able to tell them that their family loves them was very profound for me. Because these people were worthy and needing love and peace, and know that they weren't alone in their own journey. So after 8 weeks, the COVID team was disbanded. We had a lot more PPE. The agency worked really hard to get that from all over the world. And our admissions had slowed. So now, as Steve said, a COVID patient will just go to the individual team and they'll take care of that patient. But it was a wonderful experience, and I've already told management that if we do it again, if we need it, I'm signing up. So I'm already reserved my spot. And in closing, I just want to thank the Women's Giving Circle for all that you do behind the scenes. I know you do many things that I'm not even aware of. 2 that I am aware of are the grocery gift cards, which we did not utilize during the COVID crisis because it was a crisis, and we were just trying to get through the few days with that patient. But as far as I know, all the social workers have used that because people shouldn't have to worry about their next meal when they're dying or their family members dying. So that's super important. And another resource that we use often and that we did use with the families during the COVID situation was the booklets, the Gone From My Sight, When the Time Comes. Those are a wonderful, just concise, simply worded way to explain the dying process in a very just kind, gentle way. And the families always appreciate that. And when they're under tremendous stress, it's so much easier just to have something little like that they can take with them and look at over and over. So I appreciate all you do for us. And if you have any questions, I'd be glad to answer.
Wonderful. Thank you so much, Laura. We are so appreciative of what our staff do every day, but particularly going above and beyond with their courage and service that you and your team have provided. We do have one question, and it goes back to Steve, and that is, what is our plan for the future use of volunteers?
We are working on increasing our volunteer utilization slowly. So some of our volunteers have now started working in the inpatient unit where we feel we have more of a safe, controlled environment. So that's already taking place. We're not going too many home visits yet. A special situation we may, I guess the quickest answer is we're slowly going to be increasing volunteer utilization as we feel it's safe. So, but some already, and we're already finding some more ways that some volunteers are now helping in still being social distance and from home in some different ways, and some letters and some comments with our patients that it seems to be working out well too.
All right, thank you. So now we will move on to Patti Anewalt.
Hi, everyone. Hold on. I'm about to explain that you're going to see me up in a little corner, and in a moment you're going to see some slides that I put together, kind of shake things up a little bit so you have something else to look at besides me. So we're getting IT, thankfully, to help us. And I'll start talking while we're figuring that out. My first slide I thought I'd start with talking about grief, because we all get it. In fact, I was on the radio this morning and I was explaining, I think this pandemic experience is similar to back when 9/11 happened, and that everybody understands grief to some degree. So, we're learning as we're doing this. So on this first slide, I remember back when Laura was talking about, Steve and Laura were talking about in March, early March, one of the social workers said to me, she said, I think the phrase "we're all in this together" is really uniting. And I really think I saw that. It was really pretty cool how, as Steve and Laura said, our whole focus was we're still going to do the work, but we got to figure out how to do it a little bit differently. So individually, everyone was really struggling with the change of routines. I mean, just last week, I remember talking with someone who said, I had no idea how much I appreciated my colleagues until I don't get to see them anymore. So, if we go into the office, I go into my office and they're all by myself and there's nobody else upstairs in the Pathway Center whatsoever. So we missed all the opportunities that we used to have to connect with each other, to go out to a restaurant. All of us are dealing with major changes in our lives individually. Some people, it plays out by having trouble concentrating more, or there were a lot more tears early on, I remember in March and April, in particular with the staff. And professionally, we were, as they explained, all the changes that happened so that we could still do the work that we need to do. So professionally, we were being impacted, and as Steve explained, organizationally, just so many different things were going on. So I put a roller coaster on there because a lot of people think of grief in terms of stages, and you go through one stage to the other and the other, and you do better and better. And certainly we all know that's not the case. It's more like 3 steps forward and 2 steps back. It can be quite challenging at times. So it's not been easy. And I wanted to give you a couple examples, and actually Laura shared one here with the married couple. Another example that happened with our families was a daughter who was with her father when her mother died in skilled care. And after the mother died, the daughter couldn't even go back with the father to his independent living room because of the COVID restrictions. So, the family was very frustrated. They appreciated the efforts that they were making to keep everything safe, but it was comforting to the family when they knew that the chaplain and the social worker would be visiting with her, at least with the father, because the mother had died and the family couldn't be there. And then there was another call that one of the social workers, it might have been Laura, told me about, where after the father died, the mother wasn't able to go to the funeral, because if she was going to go to the funeral, then she would have to be in her room, or in her, she was in a facility too, so she would have to stay in her room for 14 days. And family that were traveling from other parts of the state who also worked in healthcare were told that they would have to not work for 14 days. So there were all these different restrictions that have happened for people when they're dealing with the whole pandemic, even if they haven't lost a loved one to the pandemic. So for the last, I'd say 3 or 4 years, we've offered virtual grief counseling, and I can count on one hand the number of times anybody took us up on it. But the second week in March, we suddenly went virtual with everything, and the Pathway Center staff with the IT help set up laptops at home and everybody started making phone calls and working from home. So it was a huge transition. We too use volunteers. It is one of the areas where we have been using volunteers. A lot of our volunteers are retired and never knew what Zoom was, but we were so grateful when we asked if they would be willing to try Zoom, because we depend on our volunteers to kind of model for our bereaved people how to cope. You know, they'll talk about how they handled the situation back when they were deeply grieving. So we really depend on them a lot. And so we were amazed when we held a meeting, a practice Zoom meeting with 17 volunteers, and they all were on the cameras and on their computers and learning how to help with groups. So we literally had been meeting, you know, weekly with some of our group series, and people had to transition to doing that from home instead. And it's not as many people, but we do have quite a few people still attending. So that's been pretty amazing. Our children's program was a little bit slower to start because, as you can imagine, we've got families trying to manage kids and work and home and all that went with that. I threw this in as a crisis slide because, you know, most other crises that happen, there's a beginning and an end. This is ongoing, so we really are, you know, it's a long haul. I actually described this pandemic, it's a marathon, it's not a sprint. So we're all trying to figure out how to adapt to that. And as you can see in that trajectory, we are still in this, what we call disillusionment phase. We're not even starting to kind of recover from all this. So I just want to point out that that wreaks havoc on everyone, all of us, as well as healthcare workers. So Laura kind of alluded to some of this. She alluded to some of the challenges, as did Steve, because our census has gone up and we're all trying to do that much more work. So staff are being impacted by this. Rachel Naomi Raymond is a physician who says the expectation of being able to walk through water and not get wet, that's as unrealistic as thinking you can work with people that are suffering and dying all the time and not be impacted by it. So people do care, but that self-care is so important, and organizationally we've really tried to encourage that people take care of themselves. One nurse gave me permission that I'm Facebook friends with a hospice nurse about how difficult it is to be the heart and eyes and ears for the family. And she, I'll just quickly read a little bit of what she says that I have on the slide. Basically, she said, we spend hours on the phone with families trying to keep them calm and updated on their loved one's status. People are dying alone and afraid, and that is suffering. No medication can replace the love of family. People are dying because of their failure to thrive without seeing their family and having that physical touch and love. We see it, hear it, and live it, and it's devastating. We do everything to help these patients feel loved and calm and communicate with family, but it's so difficult. People need to be together to say the things they need to say. These people are not dying of COVID, but of other diseases that are still progressing. Hospice caregivers have done everything in their power, but that's a lot of sadness to carry, and it makes it hard to separate out and let go of when we go home. We carry this with us. So not only the hospice caregivers, but also all the staff in the long-term care facilities. So healthcare workers have really become family to these dying patients, and you can imagine how much they're also impacted and grieving at the same time. And so this slide kind of shares some of the ways that we try to help and support them. So we have been doing some debriefing sessions where we, again, all virtual, but we will talk with long-term care facilities. We do them at 7 a.m., 6 a.m., 2 p.m., whenever they works for them, to have them have the opportunity to talk about what they're struggling with. And it's quite a challenge, but they're very appreciative of it. And we've also started the bereavement counselors for each team that they sit on. They're also talking with the team leaders and finding some times to also provide that type of support for our own staff as well. We've always provided support. We do debriefings whenever there's a pediatric death after hospice staff have cared for them or a difficult time. So this is really no different than what we've always done in Pathways. We're just doing it all virtually now. And one of the things that we do talk about, and I just want to remind everyone because we're all struggling with this pandemic, is we talk about separating out what we can control and what we can't control. Because there's so much out there that's unknown and uncertain and unpredictable, but it can really help each one of us if we really focus on what we can control. And I wanted to end up my part by reminding everyone about the importance of humor. It's such a great way to offset stress, and it's really imperative. One of the ways you can tell when people are struggling with compassion fatigue is when they don't have a sense of humor anymore. Did you know that adults laugh maybe 6 or 8 times a day and children laugh 400 times a day, which is pretty amazing. So it's really one of the best forms of coping, and I think we all need to embrace that as well. So I wanted to end this part of our time today with a few jokes that you think about it 6 months ago, we never would have even thought was funny. And I can't see it that far to read it, but I think you can read it pretty well yourself, not realizing, not being able to touch base. And this gentleman is hoping he's COVID positive because he's tired of being home with his kids. And this couple is deciding that it's time to leave because they can see somebody off in the distance. So our lives have certainly changed and will continue to change. And I think as long as we find ways to kind of still laugh amidst it, we'll get through it. So at this point, you do another slide, or how do we close that out?
There we go.
There you go.